Well, hello, everyone. I think we have begun, and we have a very special guest. We are talking about something very important. There he is, Dr. Stan Spinner, the Chief Medical Officer of Texas Children's Pediatrics. Thank you so much for taking the time to talk to us.
My pleasure.
I know that this is such an important topic. We're talking about COVID and kids, and if the two mix together, if they don't. We've done a story. It actually aired yesterday. You can see it on our website, and I believe it will play after this live stream. And it's basically on how adults are all over the spectrum, parents, when it comes to the kids, just because they want to know all the information, all the facts. And I'm sure, Dr. Spinner, you've encountered a lot of these parents with these questions. So we're going to go over some of the most common ones. And I wanted to start off by asking you, since this is a quote unquote new vaccine in terms of how much it's been studied, should there be a concern of the side effects when it comes to children of all ages?
Yeah, you can hear me okay, right? I just want to be sure.
Yes, I can. Yes.
Okay, thank you. I'm so sorry. Yeah, so I will say that really, no, there really should not be a concern. I do know that as a parent, we always are concerned about anything we do for our children. But this vaccine, the technology actually has been there. It's been studied. It's been worked on for a number of years. It's an amazing technology for a vaccine because it works so well. We have such robust safety data. The vaccine has been, given to adults now for over about a year or so, more or less. And we're talking about in this country, hundreds of millions of doses. We've been giving it to our adolescent population now for several months, tens of millions of doses. We've done, very, very careful studies on our pediatric population, the group that's now, approved, the 5 to 11-year-olds. And I can tell you that the FDA and the CDC really, really was incredibly thoughtful about, looking at data, looking at safety data. One of the physicians here at Texas Children's was one of the principal investigators, and I talk with her on a regular basis. And I can tell you that, they were so careful to be sure that they were looking at all parts of the data to be sure that this vaccine was every bit as safe for our kids as it's been for our adolescents and for our adults.
Are there any red flags or anything that you would warn parents about or be concerned about?
Well, anytime, you're talking about a vaccination, you need to be aware of the fact that there is always the possibility of a side effect. Nothing is ever 100% guaranteed to not cause a side effect. But again, we've been able to watch, so many people have been vaccinated real time in this country. So when you look at the advertised side effects, certainly in this pediatric age group, what's usually happened so far is that the kids who have any side effects, they're complaining of being a little tired, fatigued, maybe a little bit of a headache, really, which, after a day or two is over with. So they're very, very mild. When it comes to what do you watch for something more serious? Well, certainly, if someone starts showing signs or symptoms of something that's just very unusual, that causes concern for the parents, certainly, let your physician know about it. As I said, nothing is guaranteed to not ever cause something unusual. But what we see with most vaccines is that following a vaccination, sometimes someone has an unusual symptom or something happens. It may not be anything due to the vaccine because things happen every day. But, we always want to be thoughtful about it. And we certainly, monitor that. We have several different agencies as part of the CDC and the FDA that monitor for any possible side effects, whether they're really due to the vaccine or not. So we're, again, being extremely careful to be sure that we're continuing to give a very safe vaccine to our children as well as our adult population.
And one interesting thing when I was talking to you before is the fact that in the history of vaccines in this country, you were talking about the side effects and how usually with children within the first month, what these side effects are going to be. Can you talk a little bit about that?
Sure. Yeah. So often parents will ask, what about the long-term side effects? This vaccine hasn't been out for 5 years or 10 years. And again, all the vaccines we've been giving really in this country, going back to the very early days of vaccinations, if there are side effects, we see them very early on, within the first few weeks, maybe a month or two. We don't see side effects that only show up after 6 months or a year. So we really see what we see pretty quickly, and we've already seen that because of the large number of doses of vaccinations that have been given here in the United States. And really, when you think about it throughout the world, over 1 billion doses. So we know what we're going to be seeing. We don't expect to be surprised 6 months down the road. I think that's important for all of us to realize that we're not experimenting here with something that we won't know what will happen later. And what's equally important is that when we're protecting our kids and we're protecting ourselves against the COVID-19 coronavirus, we don't really know what the long-term effects of the virus is. We've seen what the short-term effects can be, and we've seen some that are suffering for months afterwards, feeling, still, having, this long COVID, what a lot of our kids are getting, where they feel that they're in a brain fog. Sometimes they're still having shortness of breath. I've seen healthy adolescents, swimmers and other athletes that after having a very mild infection, could not go up a flight of stairs without getting short of breath for months later. So we don't know what the long-term consequences of the infection can be, but we do know that we don't expect to see any long-term consequences of the vaccine.
Let's talk about myocarditis, because that is something that is concerning to some parents, especially if they have children who have some type of congenital heart something or another. So when it comes to the heart inflammation, how common is it, and should it be on a parent's radar?
Well, I think it's been out there enough to where I think it's going to be on a parent's radar. And let me put this under perspective. So many viruses can cause myocarditis, is just due to the infection. We can't really do anything about that. And coronavirus is no exception. Coronavirus has caused many cases of myocarditis, in some cases quite severe. Now, the COVID vaccine, we have seen some cases of myocarditis in our adolescent and young adult population, primarily male, and usually occurring after the second dose. Now, those cases are still quite rare, a few per million doses given. And in almost all of those cases, the symptoms have been very mild. And people worry when they hear, if they understand what myocarditis is, it's inflammation, of the heart muscle, but it can manifest itself as a little bit of chest pain, a little bit of a fluttering, a little bit of kind of increased heart rate. But generally speaking, these symptoms associated with the vaccine have been mild. They usually are gone in 1 or 2 days and require, no treatment, or maybe just a dose of ibuprofen, just to kind of, if you have a little bit of some soreness or a little bit of chest pain. We don't see the myocarditis from the vaccine doing what the myocarditis from the actual infection can do, which can be much more severe, much more longer lasting, and in many cases requiring much more aggressive therapy. So when you're looking at the risk-benefit ratio, we're talking about very mild side effects. Very mild cases of myocarditis in very rare situations in our adolescent and young adult male population. Much more likelihood of getting a much more severe form of myocarditis from the actual virus if you get infected without being vaccinated. So when you compare the two options, there really isn't any reason to be worried about myocarditis from the vaccine. We should be worried about myocarditis from the infection. And to add to that, in the studies so far in the 5 to 11-year-olds, no cases of myocarditis were seen in the study group. So again, we'll be seeing a lot more kids getting vaccinated. And could there be a case of myocarditis? Possibly. But again, we would not expect that to be any different than we've seen in the, in our young adult population, which have been very mild and very short, and transient.
So as we see this vaccine get approved for or authorized for children younger and younger, is the dose smaller? I mean, is there any difference between the adult dose and the dose that, say, a 4-year-old might eventually get or a 5-year-old gets?
Yeah, dosing for immunizations is based on age. It's not based on body size or weight. And that's very different than medications, because our body handles those things differently. So currently, the dose that's given to our 12-year-old and up patients, so really in the immunization world, 12 and up is kind of considered adults. They get the 30 micrograms. So as adults, we've gotten the 30 microgram dose. Our kids between 5 and 11 are getting the 10 microgram dose. So it's a third of the dose. And when the studies were done, there were two things that were looked at very vigorously. One is that lower dose in that 5 to 11-year-old age group. Is it being as protective. And, they're measuring antibodies in the blood on these patients, on these kids that were studied. So, 2,000 to 3,000 or at least that were in these studies. And they looked at, what they call neutralizing antibodies against the virus. And their levels of neutralizing antibodies in their blood were exactly the same, just as high as those that we saw in the adolescents and the adult population at 30 micrograms. We also certainly, looked very carefully at any side effects. And unlike the adult dose where, a lot of us, may have had some fever for a couple of days and kind of generalized body aches, in that 5 to 11-year-old age group, we saw almost none of that. And, again, having, being fatigued, being a little tired was certainly more than the placebo, and having a little bit of a headache. But majority of the symptoms that were reported in that young pediatric population, the fevers and some of the other mild symptoms, were no different than in the placebo group, where they didn't get the vaccine. So essentially those symptoms weren't related to the vaccine. So again, we've seen that we were able to give every bit as good a protection in the 5 to 11-year-old group as we have in the older age group by giving a lower dose. And in the children that are, being looked at in the 2 to 4-year-olds and the 6 months to 2 years, they are looking at potentially even lower doses than that. So that's where, we'll have more data over the next several weeks, hopefully, so that we'll be able to get our younger and younger kids vaccinated. And I'll add that they're even now looking here at doing some studies that are with our 12 and 17-year-olds who are not yet vaccinated, at giving them that lower dose, that 10 microgram dose, and monitoring to see did they get the same protection with maybe even less of those side effects. As mild as they are, it'd be nice if we could not have to deal with fever or headache at all. But so they're going to actually look at that now in some upcoming studies.
But the 2 doses is necessary for right now.
Well, currently, anyone should be getting at least the 2 doses of either the Pfizer or if the Moderna, does get approved for these younger age groups. Yes.
Okay. And, as I've done these stories, I've also encountered comments from those who have not gotten vaccines for their children at all since birth. And they ask why this one. And I know the circumstance is a little bit different. So what would you say to those who are, I guess, can be labeled as anti-vax?
Yeah, well, I've had conversations with parents for over 30 years about vaccinations as a pediatrician. And the first thing I tell parents is that you need to understand the consequences of the disease that we're trying to protect your child from. We've vaccinated ourselves into complacency because vaccines have been so incredibly effective. We've kind of eliminated many of the pediatric diseases that used to be, used to keep people scared in being in home. I mean, in thinking of polio, of course, polio wasn't just a pediatric disease, but in the days before polio vaccine, when there were outbreaks, people were literally afraid to leave their house because polio could cause death. It could cause permanent paralysis. People were in these awful, lung machines because they needed it to breathe after having polio. So when polio came out, it pretty much eradicated it. Although there are pockets of polio in parts of the world, and unfortunately, because of people not vaccinating, there's always the potential that could, be a problem again. Other pediatric diseases that I used to deal with is, in training and early in my pediatric practice, that would get me to the emergency room in the middle of the night because babies could present with symptoms that could be due to those diseases. We had to do, spinal taps. We had to put these kids in the hospital on IV antibiotics because you didn't have the luxury of waiting a few hours to see if it was that or not. Because if you waited too long, that child could die from some of those really invasive diseases. We've almost eliminated that by vaccinating our kids. So, parents need to understand that, our kids are so much safer because of the vaccines, and COVID is no different. Children have done much better with COVID than adults. There's no doubt about it. The rate of hospitalizations and certainly the risk of dying from COVID is much lower in children, but children do get sick from it. We had seen, a large volume of kids that were sick, during the Delta surge, the summer and early into the fall. We've had thousands of kids in the hospital, and about a third of those kids that get hospitalized end up in the intensive care unit. Just imagine if your child is in the hospital in a bed with all sorts of tubes, coming in and out of them, and noises and people coming to see them in masks and dressed looking very scary. Even if your child recovers and goes home, just think of the emotional impact to something like that. So we want to protect our children as best as possible. And as a parent, that's our number one goal, keep our child safe. And the vaccine absolutely does that. And so parents need to know that we're talking about a very real threat to all children, healthy children, as well as those with underlying conditions. And the only way we're going to really be able to, get rid of this is to get everyone vaccinated.
And when it comes to the parents who you've obviously spoken with that are in the hospital or their child is hospitalized and they're there, what are their sentiments? Are they wishing that they had a vaccine for their child, or how are they feeling?
Yeah, with any vaccine preventable illness, or when a child is in the hospital, as a parent, parents do feel guilty whether they could have prevented it or not. Certainly, if it's something they could have prevented with the vaccine and they opted to not vaccinate, yeah, the guilt can be overwhelming. And I've seen that with, again, many things over the many years. With COVID, again, really no different. I think all of us have seen reports of family members, once someone was in the hospital and they got sick, or even worse, the regret that was expressed by not having, gotten the vaccine. So, as one thing as an adult, you make that choice. You're responsible for your own health, and you make the choice to get the vaccine or not. But you make that choice for your children. Your child can't make that choice for him or herself. So, as a parent, it's our responsibility to make the right choice. I know some parents think that the right choice is to not vaccinate because they worry about what the vaccine can do. But again, we have the experience, we have the data, and facts are facts. I mean, you can hear all sorts of misinformation. And as I've told other people, just because you hear something more and more and more, it doesn't make it any more truthful. If it's not right, it isn't right. If the facts say that it's something that happens or doesn't happen, saying it more or less isn't going to change that. So we have to understand that we have science, we have the facts. They're indisputable. The vaccine works well. The vaccine is safe. So let's keep our kids protected. Let's keep them safe. Let's keep them out of the hospital. Anything we can do to do that, we should do. And this is certainly the most effective option we have.
And for those who have children that are younger than 5, can't get the vaccine yet, what do you advise those parents to do?
Well, use common sense. The fact that we can vaccinate anyone 5 and up certainly will help protect our younger kids who can't yet be vaccinated. It is true that even with the vaccine, certainly with the Delta variant, because it's so contagious, that we know that people who have been vaccinated can still get COVID and still transmit it. However, we know that they get through it, they get over it much quicker, so the amount of time they have to transmit the virus is much shorter than someone who isn't vaccinated. So the more people get vaccinated, the less the chance the virus has to go around and then potentially infect our kids that are under 5 or others that are severely immunocompromised, where the vaccine may have limited benefits anyway. Certainly we can also protect our younger kids by, if they're 2 and up, to keep them masked, and to certainly have others around our children masked. To limit who we have our younger kids around. So if you don't know who, if you're out in public, be sure that, you're wearing your masks, and to try to minimize that. If you're out with a lot of people indoors that aren't masked, you never know who may be infected, because a lot of people may not be symptomatic. So, those are the, mitigating factors that we've been practicing now for, well over a year and a half. But, if your whole family is vaccinated, short of the kids under 4, and you're getting together for the holidays, for instance, that makes it a whole lot safer and a lot more reasonable than last year, when most of us, did not have the opportunity to be vaccinated.
Right. Well, I know that there's a lot of people all over the spectrum, and all this information really does help out in just kind of asking you directly what's going on. So thank you so much for your time, Dr. Spinner. And hopefully this will help out a lot of people, and we'll have this posted on our Facebook and also our website as well. So
can I make one other comment before?
Sure.
Because I did realize that I misspoke when I said there's no long-term consequences of the COVID vaccine. There is one long-term consequence, and that's being protected against COVID. So I wanted to say that, because that's really what we benefit from. So thank you.
Right. I guess you could say that as a consequence.
Well, it's a result of it.
It's sure. A result. Yes, yeah. Definitely a result. All right. Thank you so much for your time.
My pleasure. Take care. Bye.
Take care. Bye.